med demonstration part 1. Date is February 7th, 2021 at 0740. So we're going to start with our first check. We have Jake Nursing, 312-654-987, 312-654-987. Date of birth, January 1st, 1960, January 1st, 1960, Dr. Skills Lab, Dr. Skills Lab. This patient has no known allergies, but we're going to reconfirm that at the bedside. So comparing my medications, I have ondansetron, 6 milligrams, intramuscular, to be given daily before supper, but this one's only due at 1700, so I won't be giving that right away. Then we have heparin, 5,000 units, Subcut, to be given daily, and is due at 0800, it is 0740, so we will be giving this medication now. This is signed by 2 transcribers. All medications here are also signed by 2 transcribers. So we are okay to start prepping. So I'm performing hand hygiene and selecting my medication. So we need heparin, and this is heparin, as long as you can read it. So we have heparin. We need 5,000 units, and it says on here 5,000 units is 0.5 milliliters. To be given Subcut, it says this can be given IV or Subcut, to be given daily. There is an expiry date here. It is not expired, so I'm okay to use this medication. I'm just going to confirm on the drug monograph that it is safe to give this medication. So heparin, can be given IV push, subcutaneous, or continuous infusion, so we were giving it the subcutaneous route, maybe administered by a student nurse. And the maximum dose is 10,000 units. We're only giving 5,000 units. So we are safe to go ahead with prepping this medication. So this is a subcutaneous route, so I'm selecting a 3 milliliter syringe just because it does have the lure lock on it. For Subcut, I am choosing a 27 gauge 1/2 inch needle. And then I'll also need a blunt film needle for prepping the medication. So we are cleaning the top of the vial for 30 seconds, but for demo purposes, we're not going to do the whole 30 seconds. And then while that's air drying, we're going to remove our syringe and attach the blunt film. Making sure to banana peel, attaching that. So I'm going to withdraw 1/2 milliliter of fluid, or of air. This is drying now, so I can inject the air and withdraw my medication. So here we have scoop method, closing that, ensuring I have no bubbles. Okay, I'm going to withdraw all of that from the blunt fill, remove that, and put it into the sharps container. Now we're going to attach our 27 gauge 1/2 inch needle, which is appropriate for the Subcut route. So attaching this. Putting that into the garbage. I am now going to pop out any bubbles we might have. That is a-okay. Okay. And there's 1/2 milliliter. So I've ensured that I have a bleb at the top of the needle. And as you can see, there's 1/2 milliliter there. No bubbles. So I'm going to create my med label now. So I have this medication for Jake Nursing. This is heparin. The dose is 5,000 units for Subcut route. The volume is 0.5 milliliters. The concentration is 10,000 units per milliliter. The date and time is February 7th, 2021 at 0740 by K. Smith, UMSN 0740. So here's my med label. Good. Okay. I'm gonna go into my second check now. So we have Jake nursing. Then we have heparin. 5,000 units. Here it says 5,000 units is 0.5 milliliters. And I have 0.5 milliliters, as you've seen. Is for given subcut. It says subcut on the vial here, and I confirmed that on our drug monograph. And it is to be given daily. Subcut route to be given daily is February 7th. Hasn't been signed yet for February 7th at 0800. And it is 0740, so I am able to give this medication. This is going into waste now. So I'm prepping to go to the bedside. I have my syringe, my label. I'm going to need a cotton ball and an alcohol swab. My drug information and my MAR. So now we're moving to the patient's bedside. As I'm entering the room, I'm performing a environmental safety check. So the environment is clean and clear of any hazards. Patient is not in any distress. So I'm good to go ahead. Hi, my name is Kaylee. I'm going to be your student nurse today. I'm here to give you your morning medications. So I'm just going to ensure that I have the correct patient here. So can you tell me your name and your date of birth? So, and I'm just going to compare to my MAR. So Jake nursing, January 1st, 1960, January 1st, 1960. And do you have any allergies? No? Okay, good. So that's what we have written down here as well. So today I am giving you a needle. It is a small injection that's going to go into your abdomen. So hand hygiene. I'm going to do my third check. So here we have Jake nursing. I confirm that this is Jake nursing. I'm giving heparin, 5,000 units, which is 0.5 milliliters. And I still have 0.5 milliliters here. To be given subcut, I have a subcut appropriate needle. And it's to be given daily, has not been signed yet here at 0800. It is now 0740. So I am able to proceed giving this medication. And just some patient education here for you. You're receiving heparin today, which is an anticoagulant. It is used to prevent blood clots. So you might experience some side effects like you might bleed a little bit more. And you might experience some local irritation at the injection site. You might even have a little bit of a bruise there, but that is perfectly normal. But if you experience any of the side effects, please let me know immediately. Ring the call bell and I will come see you. I have assessed this patient's vital signs and their most recent APTT and INR, and we are okay with going ahead and giving this medication. So, without further ado, putting on our gloves, hand hygiene. There we go. Okay, so for landmarking for this, the preferred site for heparin is in the lower abdomen. So we're inserting in the right or left lower quadrants, 5 centimeters from the umbilicus. So if the umbilicus is here, going 5 centimeters, and as long as you can grasp at least 1 inch of adipose tissue, we are good to give that medication in that site. So that is where we're giving it today. So we are cleansing the area for 30 seconds. But for the purpose of demo, it is not going to be the full 30 seconds. Going into garbage. So then we're pulling back the safety mechanism. Pulling back our needle, grasping 1 inch of tissue, going in at 45 degrees, stabilize, and inject slowly. Remove, put a cotton ball. In real life, I would activate this safety mechanism, but for demo purposes, I'm just going to place it into the Sharps container. I'm making sure not to massage the site because that is going to increase the absorption and we don't want that. So I'm just holding the cotton ball gently. And that's that. So that's going in the garbage. I'm removing my gloves, performing hand hygiene, and signing my MAR. KSUMSL. 2. I'm gonna show that to you. You able to see it? So the MAR is signed. I will be back to check on you in 30 minutes to make sure that this drug has taken effect and to see if you're experiencing any side effects. If you do experience any of the side effects I mentioned, please ring the call bell and I'll be here to assess you. But with that being said, the med is administered, the MAR is signed. I'm performing my Isaac safety check, so patient is not in distress. Call bell is within reach. The bed is at the lowest position. Our environment is clean and clear of any hazards. And that's done. Stop.